Here we are going to a short discussion about evidence-based practice. And evidence-based practice is the idea that occupational practice ought to be based on scientific evidence. Let me explain. In this picture, you can see the lumbar puncture. Lumbar puncture we do to examine or we collect the CSF. Cerebrospinal fluid we collect for analysis to find out my patient have meningitis or not. We collect the CSF and patient position should be lying position or sitting position. Imagine in my hospital, this month, 10 patients have done the lumbar puncture. Out of 10 patients, 5 patients have done lying down position lumbar puncture and 5 patients have done sitting position lumbar puncture. We found the 5 patients who have done lying position, they have less complication or no complication at all. But the 5 patients who have done lumbar puncture in sitting position, they have complication like headache or pain. So next month or in future, we trying to following all patient lying down position during the lumbar puncture. Because last month we observed, we saw the 5 patients who done the lumbar puncture in lying position, they have no complication at all. But the patient who's sitting position, they have little bit complication. Then in my hospital, in my unit, all of the healthcare provider following the lumbar puncture in lying position. So it is evidence-based practice. What we observe, what we learn, what we experience, and then we implement it for better outcome. So in this picture top, evidence-based practice, our main target to improve the health and improve the outcome. First of all, we try to find the research that is evidence-based. Also evaluate the practice or change in patient outcome. Our target is improve the patient services. Also appropriate. So what we did, it is my personal opinion. Maybe other people will not follow it. So we need appraisal, the evidence, and then implement the appraisal evidence. And main target to improve the patient health. So evidence-based practice, as I told you, it is the idea that occupational practice and based on scientific evidence. The nurses play a key role in helping to prevent the illness before it happens by adhering to evidence-based infection or control policies. Like here, let me read, patients undergoing the lumbar puncture. So lumbar puncture is one of the example here. So evidence-based research or practice or evidence organized by several types or way, like introduction types, systemic review, guidelines or summary based, randomized control trial, cohort study, or case control studies. What we wrote here, patient undergoing lumbar puncture are at the risk for experiencing over sedation and side complication of post-procedure headache and excessive loss of cerebrospinal fluid. So this is the healthcare provider pushing the needle, right, and collecting CSF. Sometimes it causes excessive loss of CSF, and after the procedure, headache is a common complication. And also patient, we give some sedatives. Also, it is a risk for experiencing over sedation. In addition, the procedure itself can be painful for the patients. Therefore, research has focused on ways to make the patient more comfortable during and after the lumbar puncture and on the risk factor of lumbar puncture. Although an epidural blood patch may be effective in the treatment or post-procedure headache in some patients, it is not effective in preventing this headache, and it leads to intracranial hypertension. So evidence-based practice, basically during our uh, working, what is the skill or experience we gather, then everything we organized or evidence-based research practice we do, and we try to implement them. Most common evidence-based practice we practice in infection control or oxygen use in the patient is COPD, or measuring the blood pressure, or intravenous catheter size and blood administration.